Hey guys, it's your digital girlfriend Danielle here. I am at Dr. Konstantin's office in New York City, New York, and I'm going to get a vampire facial, and I'm going to take you guys with me so you can see the step-by-step process and see how it happens and the reaction on darker skin tones. So this is what my skin looks like right now before. I just want to get up close so you guys can see. And I'll be recording through most of this, what I can, and we'll be asking Dr. K some questions, and we'll go from there. So you can see Dr. K's office. He shows before and afters of his work. It's a really cute office. It's clean. The staff is nice, attentive. These are all things that are important to me and should be important to you when you're looking for someone to do anything to your face cosmetically. You want to make sure about that kind of stuff. So we're about to do the first step. The doctor's assistant is going to put numbing cream on my face. The numbing cream will help so it won't be as painful to me. So I'm waiting for the procedure to begin, but we have the numbing cream on. I showed you guys as they were putting it on. This will stay on for a minimum of like 15 to 20 minutes. It's been about 15 minutes now, but it's starting to kind of, I think it like kind of absorbed into my face a little bit. My face doesn't really, it feels a little numb, but I'm trying to think of how it feels. A good way to describe it. You know when you like kind of like, when they numb you in the doctor's office, when you go to the dentist, and they will like numb in your like lip or something like that, or in your like gum or whatever, it feels like that a little bit. It's just a little tingly. So right now what we're doing, we're just gonna take my blood, because this is the blood that's gonna be used. This is the blood that's going to be used for my face, but I have very spider veins, they call them here. So my veins roll, meaning that like sometimes you just try to do it and you don't get blood out of the vein. So now we're doing it again. My blood was taken and they're putting it in the centrifuge right now. I feel a little faint right now because they had to take my blood 4 times. My veins roll. I don't know if anybody else has that. So if you have veins like that, make sure you hydrate very well before you come for a procedure like this. It'll just help the process. If he wasn't able to get blood from my veins, it would have been no problem. What he would have used instead was hyaluronic acid, which is very important. I use that on my face every day, so I'm very happy that we were able to use my blood.
Hey,
hi.
We are on air, right?
Yes, we are on.
Perfect.
We are on air, yeah.
So today, and I'm Dr. Konstantin, by the way, and today we are doing a great procedure. We're doing PRP microneedling, and PRP, of course, stands for Platelet Rich Plasma. So we did a little bit of a procedure a little earlier, yes. Right? We took the blood, and of course, it took us a few tries. Feel so sorry for my patient. And we centrifuged the blood to isolate the biologically active factors in the blood, which contains in platelets. So now we're going to be using that fraction of the blood on the skin to rejuvenate the skin, make it look smoother, make it look shinier, brighter, pretty much everything we all want.
Yeah, I'm really excited to be here with you today. I met Dr. K a few months ago, and I just loved how you were very knowledgeable about everything we spoke about. In addition to that, I looked up a lot of your reviews and even had an opportunity to talk to several of your patients before you came in, and everyone was just talking about how natural looking that you do things and that your honesty about things as well. I have never had Botox done before. I'm very afraid of it. So when we were talking, we spoke about this facial would be a good alternative for me, or alternative for people who may not feel comfortable with that procedure. I'm really interested in this facial as well too. It's also known as like the vampire facial.
Absolutely.
Yeah.
And don't let the name scare you. It's great procedure for people who like natural things, right?
Yes.
Because a lot of people, especially in New York, they say, "Oh, I don't want any of those foreign things in my body. I want everything natural, and your own blood, nothing can be more natural than that.
Yes.
Right? So we're going to be using that, and we're using a special device, and we're going to show it to you a little bit later. There's a special device that we're going to use that's going to do the microneedling part, right?
Okay.
So it's tiny, tiny needles that go through your skin and create the channels, and through those channels, platelet-rich plasma is going to sift through and get to the levels where the skin cells live, and it stimulates them to divide, to lay out collagen, do all those good things that we want the cells to do.
Okay, I had a few questions for you because I've seen a lot of this on the internet, but I haven't really seen a lot on African American skin. So I just wanted to talk to you a little bit about that. You know, like we're more prone to hyperpigmentation and keloiding. Is that a potential side effect of this kind of procedure?
So this kind of side effect is really minimal, because when we do something like a laser skin resurfacing and we burn the skin, there is a very significant trauma to the skin, and the skin has to repair itself. And while repairing, the skin actually looks rejuvenated, right? It's just almost accidental. But when the skin is a little bit on the darker side, there is always a possibility of developing what we call post-inflammatory hyperpigmentation, right? So when skin appears in some areas even darker, but that's caused by inflammation, right? And inflammation is caused by use of laser or deep chemical peel. Now, the beauty of this treatment that there is no inflammation. Right, we really don't damage the skin in any way. We just put tiny openings with a very small needle, right? So really, the chances of somebody developing a problem with this treatment are minimal.
Okay, and what kind of results can I expect to see from this procedure?
Okay, so you should feel that your skin is smoother, the texture is going to improve, and it just has this kind of bright, shiny look. It really looks rejuvenated, and it's like going to a spa and getting the skin treatment, and you walk out and you touch your skin and it feels so great, it feels so smooth. But with this one, it's just going to last much longer than when you go to a spa and it lasts for about a day or so.
Okay. And how often should you get this procedure, and how long is it? Do you see results immediately, or does it take several procedures to see results?
Okay, great question. So typically we recommend doing this kind of procedure maybe every 6 months or so. Initially, during the first day after the procedure, you're gonna see maybe a little bit of crusting, maybe a little bit of redness. So you don't quite see the results yet. Typically, you start seeing the results 2-3 days after the procedure, right? And that's when you see all that rejuvenating effect of PRP.
Okay. Another thing that I liked was that this was very minimal downtime. So you said it's about 24 hours downtime?
I would say the next day the skin is just going to look a little red, so really not a big deal.
Okay. And then does that mean when it's like, so when I leave here, do I have to go home? Should I, how do I take care of myself post this?
Right, yes, great. So tonight I recommend you going home and staying home, watching TV, doing something fun, because you're definitely not gonna look like you would be ready to go out. Right?
Okay.
So there's gonna be some crusting on the skin, there might be just tiny bit of bleeding, and that's definitely going to be noticeable. And you cannot put makeup on it because the makeup will of course plug those channels that we created, so that wouldn't be a good thing.
Okay.
But starting tomorrow you can pretty much get back to your normal life. You can start your normal activities, you can go exercise. Just moderate things, use your common sense, don't overexert yourself, don't pressure yourself. But usually a day or 2 days after, people just get back to their normal lives.
So you say it'd probably be safe not to wear makeup for like 3 days probably?
I would say yes. So 2-3 days, depending, everybody's slightly different, but 2-3 days we recommend not using makeup, because that makeup can get into those channels and create some irritation.
Now I have another question, because I love skincare. What about my serums? Is this a perfect time to be doing face masks after this and putting like my serums with hyaluronic acid in it, or should I just leave nothing on my skin? Should I wash my face tomorrow morning?
It's great to hear all those questions from an expert, right? So yes, hyaluronic acid is fantastic, and we mix the hyaluronic acid with the PRP to actually potentiate and increase the hydrating effect of PRP. Now you just have to be careful with the serums. Depending on the ingredients, some of them can contain acids, some of them can contain peeling acids, retinoic acid. So all those things are not designed to go deep into your skin, right? So they are for superficial treatment only. So even though it seems like a great idea, right, it not always it would work. So I would recommend using pure ingredients such as hyaluronic acid. That definitely you can put on.
Okay, great. Is there anything else, because I like that you would say that when someone is considering this procedure, or is there someone that shouldn't get this kind of procedure?
People who are prone to skin infections, who have active skin infections, people with very sensitive skin who develop eczema very easily, develop irritation, rosacea, so skin conditions like that, one have to be very careful with any procedure that can add to the irritation of the skin and create problems.
Okay, I think that's all my questions, so thank you so much.
All right, excellent. So we'll be getting started.
All right.
So this is the magic, right? This is platelet rich plasma isolated and concentrated here in this solution. And we drew 10 cc's of blood, and this is at the end, this is what we get. So this is hyaluronic acid, and we love using the PRP with hyaluronic acid because it moisturizes the skin and really helps to make it look and feel smooth and silky. And this device is microneedling, so it has a battery in it, and this is the sterile tip that we use. Now this tip has multiple tiny needles that go through the skin back and forth. Sometimes people use rollers for this purpose with the needles, but the rollers is definitely not my favorite because they can damage the skin, they can scratch the skin a lot more than this device.
We finished the procedure, and my skin right now, my face is pulsating. Everything feels very tight. It hurt. I'd say I'd give it like a 6 on the pain scale. Mask feels absolutely incredible. It's cold. What is this?
This image,
Okay.
hydrating hydrogel.
Oh, okay.
Hydrogel sheet.
Mm,
And you can get one at home.
okay. 15 minutes you said, right?
Yeah.
All right, thank you. Okay. All right, she just took off the face mask. My skin is feeling a lot better. She's gonna wipe this off so I can go out in the streets in public and not have everyone staring at me like crazy. Is it better to leave this on? Should I want to leave it on like
No.
this? Okay.
No.
Okay, so I'm getting ready for bed, but you have to wash your face afterwards. So I used this. It was really gentle on my skin, Korean skincare. And I've chose something gentle because I just wanted something that didn't have a lot of ingredients. My face is very red. It's very raised a little bit too, you can see. It feels very textured. You can see right here, it's like flaking. It looks a little bit, on camera it looks like a pimple, but it's a flake. So my skin's flaking a little bit. It feels tight. It was hurting a little bit. They gave us a mask to put on. They gave me a mask to put on. So I just kind of put on the mask. Lagom is great to use on the skin. I'm going to finish using this over the next few days. My volunteering got canceled tomorrow, thank God, because I don't want to go out looking like this. I'll give you an updates over the next 7 days, and then I'll do a picture in a week. I'll do a picture in 2 weeks and 3 weeks. They say in week 2 or 3 is when you see. And I'll also take you to my follow-up with the doctor. Hi guys, so I'm just giving you an update on the vampire facial. We are exactly a month out. It's been 30 days since I've gotten it. I've been so happy with the results. I love it so much. The biggest thing I've noticed is how smooth my skin is. The texture of my skin has really changed. Makeup lays differently on my face. I know this, my smile lines, those wrinkles we were talking about, I noticed that they have lessened as well too. So I'm really happy with these results. It was super painful, as you guys could see. I thought that I would never get this done again. I was just really polite with Dr. K, but he was absolutely right. He said that I would be seeing the benefits of this for weeks, months afterwards. And after 1 month out, my face just feels radiant. My skin just feels good. I love it. So the recommendation was once every 6 months. So I will be definitely going again in another 6 months to get another one done. Actually, I'll give you 5 things that you should know. 1, this is definitely an investment. These can cost up to $1,500 per session. It averages around $1,300 depending on where you live. The second thing is that it is painful, even with the numbing cream. 3, I didn't wear makeup for 2 weeks. I personally think that had a lot to do with it, but that's just my own just personal hypothesis on that. The 4th thing I would also want to tell you guys is that the results last way after. I was so scared immediately after I got this done, but then the minute I've been seeing the results, like, you know, a week out, 2 weeks out, 3 weeks out, and now a month out, I'm super excited. And the last thing you guys should know about a PRP facial is that it's a great alternative to Botox. So give it a try. You could see it on my skin. I have nothing on my face right now, and I'm just super happy with the results. Thanks, Dr. K.